everybody, it's Christina. Let's talk Chiari and tethered cord. For starters, what are Chiari and tethered cord? Well, Chiari, also known as an Arnold-Chiari malformation, is when the back of your brain, the cerebellum, slips or gets pulled or pushed downwards into the top of the spinal column. This often cuts off the flow of blood and CSF, as well as compressing some of the surrounding nerves. Chiari usually causes debilitating headaches, but it can also cause any number of other neurological problems, ranging from mild to life-threatening. Some of the most common being dizziness, balance problems, vision problems, numbness, tingling, weakness, ringing in the ears, and nausea. While there is no cure for Chiari, it's often treated with surgery. The surgeon will go in and remove some of the surrounding bone and vertebra to decompress the brain and the nerves and to try to restore proper flow. And tethered cord syndrome is when the spinal cord is found to be inappropriately attached or tethered to the inside of the spinal column. Usually, this attachment or tethering occurs right at the very end of the spinal cord. A lot of cases of tethered cord are seen in correlation with something called spina bifida occulta. This means that when the person was developing in the womb, their spinal column and vertebra never fully closed and the spinal cord never fully detached from that tissue. Then again, a lot of cases are completely unrelated. In fact, for some patients, it's something that they acquired in life and not something that they were born with. Unfortunately, some patients even re-tether after already being surgically treated. Your spinal cord is supposed to be loose and free-floating within the spinal column, except for a small attachment of nerves at the end, which we call the filum terminale. But in tethered cord patients, the cord is pulled tightly and stretches with any movement, which really heavily impacts all of the surrounding nerves. A tethered spinal cord usually causes lower back pain, leg pain and weakness, bowel and bladder changes, and even in some cases scoliosis or kyphosis. Like Chiari, tethered cord can only be treated through surgery. The surgeon has to go in and very carefully cut the piece of tissue that connects the spinal cord to the wall. Now you may be wondering why I chose to pair these two up. One affects the very, very top of the spinal cord, and one affects the very, very bottom. But when it comes to the spine, everything is very heavily connected, literally. In fact, it seems to be common belief among doctors now that a Chiari malformation can be caused by or partially attributed to a tethered spinal cord. The belief is that all of the tension from the tethering is at least partially responsible for pulling the brain downwards into the column. Cases like this seem to be especially common in patients with EDS, because the tissue that is responsible for holding the brain upwards is weaker than it is in the general population. Unfortunately, in cases like this, treating one of them is often not enough and can even cause the other one to worsen if ignored. Because of this, I highly recommend that you have a full workup for both if you're even thinking about going into a surgery. In fact, I also recommend that you have a full workup for craniocervical instability, cervical instability, and syringomyelia, as those are all common comorbidities and can really complicate a decompression surgery. I'm hoping to get into those a bit more in a future video, so keep your eyes open for that. So how do you get diagnosed? Well, both Chiari and tethered cord can be diagnosed using an MRI machine. It is recommended that you get an upright MRI done if at all possible, because the effects of gravity are usually much more significant on us, especially when trying to diagnose a Chiari malformation. Now here's where it gets a little tricky. In a case of true tethered cord, the tethering will be visible on an MRI scan. But with a lot of EDS patients, it's not always that simple. Sometimes the cord is tethered, but the tethering just isn't visible on the scans. These cases are called occult tethered cord. This definitely complicates things a bit for the surgeon. The diagnosis then has to be made based on the patient's symptoms, various clues from their MRI scan, and the testing of the affected nerves. This is most commonly done through something called a urodynamic study. A urodynamic study can pick up on irregularities in the nerves that control the bladder, which are usually impacted when a patient has a tethered spinal cord. In fact, this study will probably be done even if there is visible tethering on your MRI. Something similar can also occur in the diagnosis of a Chiari, especially if the patient's original MRIs were taken while lying down. And this would be called a Chiari 0. There seems to be some disagreement among surgeons if this is a real diagnosis or not, but I can tell you a lot of patients who have undergone treatment for it have experienced a lot of relief. So I will just let that stand for itself. A Chiari malformation is usually diagnosed by how many millimeters below the base of the skull the brain herniates. In a Chiari 0, there is no herniation visible on the scans, but the patient is still experiencing all of the symptoms. In a lot of these cases, the CSF and blood flow are just as blocked as they may be in a true Chiari case. Now, can you have one without the other? Of course. People have one or the other all of the time and undergo treatment for one and never experience the other. The correlation is simply just something to be aware of if you have Ehlers-Danlos or if you have received a diagnosis for one of them. If you have any more questions or if you have an idea for any future videos, please let me know down in the comments. If you liked this video, please give it a thumbs up. That way I know what kind of videos you guys like to see. And I'll see you next time. Goodbye.